All right, this is for all you guys out there. This lady has high blood pressure. All right, what causes high blood pressure? I bet, because you guys are so smart, I'm going to really think this out. What causes consistently high blood pressure, not swinging blood pressure? You know, swinging comes from the inflammation in the cerebellum, but what comes in steadily high blood pressure? Kidneys and adrenals, absolutely. The kidneys are the high diastolics, which push up the adrenals, which is the systolics. Always go after those kidneys. So here here's the causative problems, okay? Here we have kidneys not filtering. So kidneys, after a while, check her creatinine, by the way, dear. Check your mom. Get a copy of your mom's blood work. If you have to send it in, send it in. I'll go over YouTube with it if you want me to and show you the blood work. But look at her blood and creatinine. You want to see where she's at in your creatinines now. Because with high blood pressure means she's losing her kidneys. Now you're losing your kidneys. You can be not filtering and not lose your kidneys. Your blood pressure seems normal and everything's good. You're just not filtering. In time, when the kidneys lose filtration of themselves, this is when you see inflammation in the kidneys, and then you see the high blood pressures. I have high blood pressure. Okay, stop right there. High blood pressure. You have high blood pressure, and you almost answered it with your next problem. Your next problem is kidney disease. Right there's the problem. Right there's the problem to high blood pressure. Now remember, if it's a swinging high blood pressure where 1 minute it's high, the next minute it's normal, or it's high when you're out and it's normal when you're at home. Cerebellum, inflammation, acidosis, still from kidneys. But when the kidneys start to go down, high blood pressure. Diastolic is your kidney pressure and systolic is your adrenal pressure. Kidney disease, you got to turn that one around because remember, these are the eliminative organs of your sewer system. You don't fix your sewer system, that's all the lymphatic system. The lymphatic, lymphoma, inflammation, all that's from that same system. So she needs to get herself cleaned out. She has high blood pressure. Well, there you go. And she's had this since she was 37. So that shows she's had kidney problems in her 30s. Well, this is your mom. This is your mom, so little Miss 40, guess what? You got to take care of yourself and look at your dad. Your dad is adrenal and kidneys too, so you got two parents coming down on you, and I bet if you dig, you'll find your grandparents. So that's what's coming. It's just that we're focusing the light on the real problems here, where medical people keep that dark. And we need to put the light on truth. You can use niacin for high blood pressures. I'd rather use an niacinamide, but I actually go to the cayenne garlic with other herbs in there to gently dilate the vascular system and have blood moving more. Nettles does the same thing. There's a lot of them that does some dilation there. Ginger a little bit does that, little ginger tea. That would be recommended as opposed. Niacin, I don't know, pretty flushing. I don't get into isolates anymore, but B vitamin isolates, I don't bother. They're water solubles. I don't really care too much about that, except for the vitamin C's. No way. You want the whole flavonoids, and you're assured if you eat fruits and berries and melons to get the whole flavonoid complex. Get away from isolate thinking, and you'll be a lot better off. But again, niacin or niacinamide are good stat Bs to have on hand in case you're in a stroke, heart attack situation. Niacin would be really good then.